I'm William Mayer. I'm a GP and I also am a GP fellow with the Training Hub. So I'll just talk to you first of all about the different organisations in Barnet, because it can be quite complicated to understand how they all interact and what their different roles are. It's certainly taken me a long time to get my head around what each of the organisations' responsibilities are. So first of all, the Training Hub, I work with the Training Hub. That's who are delivering this induction program. And our focus is about improving training and education in clinical and social care. And our work is community focused. And the sort of main tenet of our work is always that the patient is at the center of everything we do. So everything we do is about trying to improve the care and experience for our patients. And we do that through, as I mentioned, education, also promoting the well-being of our workforce, and with the idea that hopefully by having a happy and well-supported workforce, they'll be better equipped to deliver good patient care. Then there's the CCG. So previously there were 5 separate CCGs in North Central London, which were Barnet, Camden, Islington, Enfield, and Haringey. And in April 2020, they formed one combined NCL CCG, North Central London. But they do still work, sort of in their own area, in their own boroughs, in certain things. So, for example, this induction program is just being delivered for Barnet. Other NCL CCGs and training hubs have got their own induction programs. The role of the CCG is about being responsible for the funding of all community and hospital services. So, the CCG holds all the funding, and they commission different services and providers to provide all of the care in Barnet. I'll go through the providers in a moment. Then there's the federation. So the federation, there are federations all throughout the NHS. In Barnet, the federation is one big federation called Barnet Federated GPs, and it's all of the GP practices in Barnet who have pulled together for certain services where it's not efficient to deliver them on a smaller scale. So, for example, there's the pharmacist-led anticoagulation service, there's the diabetes quality improvement team, extended access appointments. So, because all GPs are contractually obliged to offer 8 till 8 appointments 7 days a week, and that's not efficient to do that on a local practice level. So the federation offers those appointments. And then there's the PCN. So there are PCNs which make up Barnet, and they are groups of practices smaller than federations. They receive funding to provide additional workforce and services. For example, that there will be PCN pharmacists who work amongst a number of practices, again, because it's more economical to do it that way. And the PCNs are led by clinical directors. So you all should hopefully know who the clinical director is in the area that you work, and they would be an important point of contact if you ever have any issues. This is just to show you how Barnet PCN is divided up. So you can see that there are different sizes, both geographically and in terms of patient population, and that tells you why each PCN will have very different ideas about what's important for them to fund in order to meet the needs of their local community. I mentioned about the providers. So, the CCG will commission services to community hospitals. As you know, there's Edgware Community Hospital, Finchley Memorial, Chase Farm. They'll commission a lot of services to secondary care hospitals. They also fund services for our tertiary care hospitals. So those are the specialist places like the Stanmore Orthopaedic Hospital, Royal National, Moorfields Eye Hospital, Great Ormond Street for Children. And then, of course, there are also the mental health trusts. So really, a wide range of providers that offer services for the CCG to decide. It's important that you do have a good local induction in your practice, and you should make sure that certain things definitely get clarified to you during that induction. So you need to make sure you've got smart card access. You need to have your passwords for EMIS and DocMan. You need to make sure that you've got an NHS mail account set up and that the practice knows, or the number of practices that you're working in know your email address so that they can add you to their mailing list. I think one of the most important things you should do early on is getting to know your team. Learn the names and the roles of the people who you're going to interact with regularly and how they can help and support you. Because when you're new in primary care, you really do want to be able to feel comfortable to turn to anyone for help. And I'm sure that the teams that you're working with will be very happy to help you. And the earlier you can get to know who they are and how each different member of staff could help you, the more effective it will be. Make sure that you know how to book annual leave. Make sure you know how much notice you need to give, and agree this locally as well. Those of you with primary care physio, obviously they manage your annual leave, but make sure that you agree locally within your PCN and your practices before you sign it off with primary care physio. And also, it's really important that you've got the details of who to contact if you're sick, so that if you are sick at the last minute, they can cancel your patients. Otherwise, there'll be a big last minute panic. I know that for the most part, you're working remotely, but when you are on site, it's really important that you know where the emergency equipment is kept, the defib and all of the other emergency equipment. Hopefully, you'll never need it, but it is obviously really important that you know where to find things should you ever need them. And then, I think you've probably all done your mandatory training, or that might be arranged through primary care physio, but that is, of course, important. There's a checklist in the induction pack, which is quite long, and so not all of the points in that checklist will be relevant, but I think it'd be helpful when you are starting out somewhere new that you just have a quick look through that and make sure that all the important aspects have been addressed before you start consulting with patients. Talked a bit about practice staff. So there is an ever expanding variety of roles in primary care, FCPs being one of the new roles. And so it is going to be helpful for you to get to know what the different roles are. There is information in the induction pack, but the best way is to talk to the different staff members, find out a bit about what they do. I think for FCPs in particular, it would be very helpful for you to sit with the reception staff at some point, because your role is new and it's really important that reception know how to use you efficiently. So, spend time with the care navigators who take the calls, show them which sort of patients they can refer to you directly, because I think what's happening at the moment in some practices is the patients are still getting booked in with GPs, and then the GPs are booking them in with the FCPs, and obviously that's not very efficient. So the more time you can sit with the receptionist and get them to understand what's appropriate, the better. And of course, it is also important just to see their role, because they are the gatekeepers and they manage a lot of calls every day, and it's important for us to understand how hard their role is, how much of a challenge it is on a day-to-day basis. Supervision is obviously important. Make sure that you know who is responsible for your work each session, or who you can turn to, which GP you can call or speak to about a patient if you've got any difficulties. My understanding is that those of you with primary care physio will have 4 hours of protected time, full-time equivalent, to have 1 hour for one-to-one supervisions. Is that Is that correct?
So one of the hours will be kind of more the supervision one-to-one with Ashley. For myself, it's with Ashley. I think Suresh, you're also going to be with Ashley.
Yeah.
And that's once a week. And that will either be a combination of discussing complex cases or discussing any other kind of issues which come up. And then generally the other 3 hours will be to do our own CPD, which we need in order to meet the criteria to get accredited as an FCP by beginning of, I think it's next year, basically. And I think we also have once a month, primary care physio has its own in-service training. So I'm assuming that comes into that 4 hours as well. So that week there'll be, I guess, 2 hours.
If you are able to, have a named GP that you can speak to, then just discuss with them in advance of your sessions how they want to help you. Do they want you to call them, send them a message? If you're on site, do they want you to come in and talk to them maybe at the end of a session? So it's just good before you start each session to agree how that supervision should take place. And so there are a number of resources that might be helpful for you in your work. The NCL CCG website has got a number of pathways, including MSK pathways. Have you all registered for this website? See at the top here where it says register? If you haven't, that might be why the link isn't working. You've actually got to create an account that you sign into, and then you can find these pathways. And then the pathways are really helpful and easy to search. So if you just go to the search here at the top right and you say enter shoulder, then it will come up with here, Barnett shoulder pain primary care protocol. It's a little bit slow, so just bear with it. I don't know how well you can see that on your screen. Just give it a second to load. So yeah, then it will tell you what the primary care protocol is for shoulder pain. It will tell you when you should be, for example, down here doing blood tests, referring to rheumatology, when you should be doing ultrasounds. I mean, a lot of this stuff is more for GPs, and so in terms of the actual management, you'll all be familiar with it. But in terms of the pathway, I think it would be helpful for you to know what we're all supposed to be doing in Barnet. So GP Notebook is also free for use. You can register an account on there, and I find that a really helpful online resource for looking up, all clinical conditions. So you'll find some helpful management tips and investigations and things on that. So I recommend these 3 as a sort of go-to in your day-to-day practice will really help you.
Okay.
So in terms of your work as FCPs, MSK presentations represent about 20 to 30% of all GP appointments. So you can see why there is a massive need for MSK specialists in primary care. The intention is that by 2024, all adults in England will be able to see an MSK FCP at their local practice without needing to be referred by a GP. Hopefully that will be happening in Barnet much quicker than 2024 with the fact that there's a lot of you working here already. The appointments should be 20 minutes. The idea is that they are person-centered, patient-centered, and that you're making shared decisions and management plans with your patients. It's really important that you use the templates. So I know that primary care physio have got some templates. And the reason that those are important is because they encourage you to code certain things, which is essential for then data to be extracted about, FCP consultations and auditing. Do you use templates, or have you had any problems with the templates?
We can't download our templates yet because we don't have the permission, and Ellie is working on it.
Okay. Well, as long as it's in process, once they are available to you, I would really encourage you to use them. It might feel a bit clunky at first because you're ticking lots of boxes and relying on EMIS not crashing. But once you get familiar with them, it'll be really helpful for data collection. Make sure. Sorry, did someone want to ask a question?
I just wanted to ask. I think you age-wise, you said age 18 or above, but I know, I mean, that's what I think when I started, we were doing that, but now we are also seeing patient from 16 to 18 in the presence of their parents.
Right. Okay. And that's been agreed with primary care physio, has it?
Yeah, I think we're just following the Health Education England and the CSP guidelines.
Okay, great. Thank you for. I'll make sure I change that on these slides for next time.
Yeah, that's fine.
Now, you mentioned earlier, Ashri, about terminology, and I did want to talk to you about this, because the primary care physios certainly are saying that we should be encouraging all members of the practice team to call you first contact practitioners or MSK specialists, and discouraging the use of the term physiotherapist, because, as you said, it sets the wrong expectations for a patient if they think they're going for a course of therapy, which is not the idea. I was going to ask, do you all agree with it? But it seems like from what you were saying before that you do all agree with that. Finally, on this slide, just mention about overtime. So if you want to do overtime and you feel that there is a need locally, you feel like all of your appointments are fully booked and that you have patients wanting to see you and they're having to wait a long time, it is possible, depending on agreement between your PCN and primary care physio. So that is something you could consider. I don't know if anyone has actually looked into this or done this, but I'm aware from primary care physio that that is an option.
Yeah. I'm not with Barnet, I'm not sure, but with I think Loxford and Ilford, I have done some overtime. I think that's because of the system, the regular staff couldn't work. So yes, there is an option, but although we've never had to do it in Barnet, so I think our diary is I think the wait time is usually like a day or two. So I don't know, Josh and Suresh, if you agree with me. I think it hasn't come to a point where we probably need overtime. Just with the FCP diary, I think.
Yeah, I think it's early days, isn't it, for FCPs in Barnet? So I'd be surprised if there would be any need for it now. But it may be that, in a year or 6 months or whenever, the process is more established, then that might be something to consider. So just to bear it in mind, really.
Yeah.
I think it's important that you do have access to material like this on screen so that you can make sure that the practices you're working with have it up in their reception. And then in terms of the outcomes of your consultations, these are just based on annual PCN data. So most of the time, hopefully, you'll be able to give self-care and advice, and that will be able to close the consultation. You may be referring on to physiotherapy. You may be referring for joint injections, or, as you mentioned, doing the joint injections yourself once fully trained up for that. You need to be able to refer for imaging. In terms of prescribing, I know that it's possible for some of you or all of you to become independent prescribers. Are any of you training to be an independent prescriber?
Hopefully, after I pass my injection, hopefully that's the next thing. But
Right. Okay. So this may not be that relevant to you yet, but when you are able to prescribe, or in the future, then make sure you've got smart card access for that. And even at the moment, if you feel confident that you want to put a medication on for the patient onto their EMIS for a GP to sign off, speak to your GPs who you're working with and ask them if they'd be happy for you to do that. Our pharmacists do that all the time. They add them onto our EPS and we sign them off. So I think that's important to discuss. That will get you some very helpful experience in prescribing, even if you haven't got the qualification yet.
I've actually sent tasks to a couple of GPs medications, and like they were happy about it, and yeah, so I've done it that way. And some of the patients I spoke to, the expectation was like, yes, I will do the exercises, but can you also give me some medication? So in those cases, yes, and some acute ones did need some medication anyway. So
if you're doing that already, then it'd be even better if, rather than having to send a task, if you could actually put the medication onto their prescription page on EMIS to get it signed off. That would be even better.
Brilliant.
Okay, we talked a little bit about CPD, but just in a bit more detail. So For primary care physio, I understand that you have an afternoon of training every month, and you've got your 4 hours protected time as well. In terms of other things that you could do for CPD, so I definitely encourage you to try and get involved with your local practice clinical meetings. Again, if you're working with 15 practices, you're not going to be able to join every meeting. But if you could join one meeting a week, maybe rotate between practices, that will, first of all, help the practices, the clinical teams, to get to know you and to know your work. It will also give you an opportunity to bring some cases if you want to discuss it with the team, either for your learning or for their learning. So I really would encourage you to get as involved as you can, as your time allows, and you'll enjoy working in primary care a lot more if you feel that you are working with the team, and the practice meetings are a really good way to engage with that. And then also, if you've got time, in between your sessions, and you'd like to do some quality improvement type work like auditing, that would be really strongly encouraged. You could look at referrals to secondary care and look at the outcomes, for MSK conditions where the referral's appropriate, and feed that back to the GPs, and again, share learning that way. You may want to give presentations to your practices, for example, at their clinical meetings, things that you wish the GPs, did differently when you look at how they've managed certain MSK conditions, or, as I said, about GP referrals. So, I know you're all going to be very busy, so you have to prioritize. But as much as you feel comfortable and would like to get involved, I think all of the practices you're working with would really encourage that. So audit or quality improvement. So what that usually involves is, coming up with a question that you want to answer, and that may be, are all the patients who get sent for ultrasounds of the shoulder, are they being referred appropriately within a particular practice? And then you look at the data. You can do searches in EMIS to pull out the patient records relevant to shoulder pain and ultrasound or something like that. And you can look through the notes, and it's essentially a quality improvement process. So you then summarize your findings, you go back to the team, present your findings and your recommendations. And then, the true definition of audit is to then go back 6 months later and re-audit and see whether you've made a difference, whether your recommendations have been taken on board, and whether clinical practice has improved.
Okay. Yeah, that's brilliant. So there is a system in EMIS that when we label a particular diagnosis, there is I'm asking, I don't know, is there a system where we can just search by that syndrome, for example, impingement, and then it give us all the impingement? Okay.
Yes,
okay.
So I mentioned earlier about templates and coding. That's why coding is so important, because it then allows you to go into EMIS and search for patients who've been diagnosed with, as you say, shoulder impingement in the last 6 months, and then it will give you all the patients, and you can look into their notes. I'll let our training hub team know that you're happy to be a sort of a point of contact for all the FCPs in Barnet, and that'd be a really good way to start, I think.
Exactly, yeah. So that, like, if they have any concerns or doubts, they can get in touch with me. I'll raise it with the team, and likewise, if the team has any, I can bring it back to the training hub. Brilliant.
That's really helpful. Thank you for volunteering. I don't know if you've all managed to join your PCN WhatsApp group, your wider WhatsApp, wider groups, which have got your GPs and pharmacists and social prescribers and, multi-professional groups. If you're not in a PCN multi-professional group where you can ask for advice from other professionals, I'd really encourage you to do so. If you don't know who to speak to about joining those groups, then start with your clinical director, and they should be able to help point you in the right direction. Yeah, and if they don't have a group, then float the idea of a multi-professional group within the PCN where you've got the salaried GPs, the clinical directors, the partners, the pharmacists, the social prescribers, FCPs. It's so helpful to have other professionals to ask questions, because everyone has their own skill set and knowledge, and if you can share that, it's really helpful.
Yeah, that's a good idea. Very good idea. Yeah.
Yeah. Especially when we work from home, we definitely need that.
Exactly. Okay. Well, thanks so much, everyone, for joining today.